Hospitals Programme Manager for Food for Life, and I'd just like to introduce Claire, who's also joining us.
Hi everyone, so I'm Claire Clark, I'm Sustainable Catering Development Manager for Food for Life's Sustainable Catering Framework. So I work in the Food for Life Served Here and Green Kitchen Standard team. I'm based in London, so I will have met a few of you from trusts based in the southeast, and I've also worked closely with Susanna on sequin auditing and food waste workshops in trusts across the country.
Great, thanks very much, Claire. So today the focus of what would have been our seminar and now is our webinar is really to give us an opportunity to think about the forthcoming new policy context in the NHS. So we are delighted that Phil Shelley, Chair of the NHS Food Review, is going to be joining us to give us a bit of an insight onto the priorities for the NHS going forward and perhaps bring us up to date with where we are time-wise with the recommendations and the NHS Food Review report that's forthcoming. Unfortunately, Emma is not able to join us today. She just shared first thing this morning that she's been pulled into an emergency meeting. So again, we're really pleased that Phil is going to be able to give us a briefer update on the healthcare food standards. Then we'll move on to hear from Helen Kingett, who's the Food and Drink Strategy Lead at University College Hospitals NHS Foundation Trust. So I'm delighted to welcome Helen today, as their trust are actually just beginning their process of developing a food and drink strategy. Helen's been working on this for quite some time with other members of the trust. So it'll be interesting to hear her experiences of developing a food and drink strategy from scratch at this current time, and perhaps get her reflections on what comes next given the changing policy agenda. We've got time for questions after each of our speakers today, so I think we'll play it by ear when it comes to the facilitated discussion session and see how much in depth we want to continue our discussions. So I'm going to pass over to Claire to give us a bit of an update on Food for Life and what it is that we do more broadly for anyone that's joined us today and maybe isn't quite so aware of what it is that we do. So over to you, Claire.
Hi, so just to give a bit of a recap of what we're doing in Food for Life. So Food for Life's overarching aim is to provide support for good food for all. So that's good food no matter who you are or where you are. And what that good food means to us is a healthy and sustainable diet, so less processed food that's high in fat, sugar, salt, less but better quality meat, more fruit and vegetables, whole grains and sustainable fish, quality food that you can trust, so more fresh, local, seasonal and sustainable food that has a low climate impact and of course high animal welfare standards. Eating together, so offering opportunities for social contact through food, building families, tackling loneliness through food and bringing communities together through food. And then also environmentally friendly food production, so food that's cooked and stored with respect for Earth's natural resources.
So just to start again, I wanted to introduce our wider Food for Life Hospitals programmes to those who may be not so familiar again. It's been running since 2015. Particularly the Learning Network. We've been working with many trusts across the country through seminars and webinars where we've explored some of those key issues that have been coming up for hospitals and given you an opportunity to share between yourselves, to learn from experts, to talk about best practice, but also to share challenges. We've also, since 2015, been helping to support trusts develop food and drink strategies. We've been supporting a number of trusts to work with sequin when that was in place, and also on reducing food waste. We've also worked with policymakers, including currently working to support the NHS Food Review and the new healthcare standards with our particular expertise, both on sustainability and environmental issues, but being able to feed back what we hear from all of those trusts that we work with back to policymakers and be a voice for all of you. So today is actually going to be our last network webinar. Due to a lack of external funding for this work and also a 10-year strategic review at the Soil Association, the wider hospitals programme is going to be coming to an end, and I'll email each of you to give you a little more insight into that. But I'm going to pass over to Claire, who's going to be talking about lots of the exciting work that's going to carry on in the sector.
Thanks, Susanna. So, we're really proud of the number of trusts that we've been working with, that especially in particular that have been seen throughout the hospital food review, showcases best practice for hospital food. We know everyone's received really incredibly positive feedback. So nothing will change with our existing Food for Life Served Here or Green Kitchen Standard stakeholders. And the Food for Life team will continue to work with trusts across the country, offering our support and expertise that we've been offering for years. And we'll still be continuing monthly communications with our catering news and any updates on our wider policy work as well. And of course, our press and marketing team will be continuing to support the good food message and, telling everyone about the good work that the trusts we already work with are doing. So, we're very much still here for everyone. And the sort of sustainable catering team are still ready to work with any trusts going forward.
An introduction. I'm delighted to welcome Helen Kingett, who's a project lead. Helen has been working with a team at UCLH developing food and drink strategy. So we're really looking forward to hearing from you today about the process, what you've been going through there. So thanks a lot, and I'll pass over to you.
Thank you, Susanna. So I'm going to talk about kind of my experience of working in a project lead role, developing a food and drink strategy. So as Susanna said, my name's Helen Kingett. I'm currently working in the project lead position, which is a seconded position. So I'm in this post for 6 months, and I work at University College London Hospital. So I'm currently in the process of trying to develop a food and drink strategy for our trust. My background is as a dietitian. I've been practicing in a clinical role for the last 15 years. I've primarily worked in bariatric surgery in both a sort of clinical and a research capacity, and within that role I also sort of regularly lecture at UCL in both their undergraduate and master's nutritional courses, and I also facilitate do a facilitation role on a behaviour change course. But I've always really had a passion for wellbeing and nutrition. So when the trusts were fortunate enough to have to sort of get some funding for a project lead to develop a food and drink strategy as a secondment, I decided to apply, and what I sort of hoped to get out of that role was to enable me to learn a new skill set, which I could take back into my clinical role. But also I hope that this would really give me a really good opportunity to contribute to patients being able to receive the best possible nutrition when they're in hospital, to be able to support staff from a health and wellbeing perspective, and to help the trust really to work towards improving sustainability and food waste. So that's kind of why I decided to apply for the post. As I said, the post has been a fully funded secondment for 6 months, which I think has been sort of a really good opportunity, because it's meant I've been able to really sort of focus on developing the strategy. And I think our head of nutrition and dietetics was really keen for this to be a funded position, so that we are able to sort of co-create a strategy that could be developed following a series of discussions and events and roadshows over several months across all staff groups and sites. So it wasn't just something that we did over kind of a short period of time, that we would really be able to engage people to help us to, as I said, co-create a strategy. I guess as a trust, a need was identified back in 2014 when the hospital panel report was published. And since this point, the Nutrition and Hydration Steering Group have really been sort of trying to work to influence the key people in the trust by persisting to persuade the trust that there is sort of a gap for the food and drink strategy perspective. The Nutrition and Hydration Steering Committee at UCLH directly reports into the Quality and Safety Committee, and the Nutrition and Hydration Steering Committee writes quarterly reports that are fed into the Quality and Safety Committee, and they've been regularly sort of highlighting the gap that we need a food and drink strategy within those reports. So partly the sort of funding came from people kind of influencing and identifying a need, and sort of, you know, reports that were being written through to the Quality and Safety Committee and being fed up to the board. We also, when we had our CQC self-assessment, a food and drink strategy was identified as a gap through that self-assessment, so that also helped to contribute to us being able to get funding for the project lead position. I think also nutrition and hydration sort of grew as a priority for the trust, and the food and drink strategy was really supported by our chief nurse, who you can see there's a picture of her in the slide that I've got there. So Flo Panel Coates is our chief nurse, and she was really supportive of the fact that we needed to have a food and drink strategy to really sort of push forward some of the nutrition and hydration, you know, some of the really good work that we were doing, but also some of the gaps that we had as a trust. So following all of this, what happened was that the Quality and Safety Committee provided some funding for a project lead to develop the strategy. So that's kind of the background of how I've managed to get into a project lead position. Susanna, if you could just move on to the next slide. So I think why now? You know, obviously the hospital food panel report was published in 2014, so, and a lot of trusts have already got a food and drink strategy. So I suppose as at University College London Hospital, we're a little bit behind in terms of actually developing a strategy. But I think it's all about having, you know, for a strategy to be effective, it's about the right time. And I think really, actually in our trust, this was for us as a trust the right time to focus on the food and drink strategy. And I think some of our drivers for improvement was that there was definitely an appetite for change, and exec level support for improvements in nutrition and hydration. It was our patient experience and engagement committee. Nutrition was one of their priorities. We also have an exemplar wards initiative within University College London Hospital, where all of the wards within the trust are encouraged to develop quality improvement projects, and there have been many of these on nutrition and hydration, which has sort of worked towards improving nutrition and hydration on the wards, but it's also identified that there are some gaps in areas that need to be improved. As a trust, we've now got a green plan, and I think just general interest in wellbeing and sustainability has improved or has increased, and I think this has all led to sort of that increased appetite for change around nutrition and hydration. So I think that's one of the things that's led to sort of now being a good time. Also, some of the trust quality priorities for 2019 and 20 included nutrition and hydration, particularly around the patient experience of care and help with meals. Both the Patient Experience and Engagement Committee and the Quality and Safety Committee have to report into the board, and they have to report on improvements that are being made from a nutrition and hydration perspective. So I think the fact that we had these quality priorities helped to sort of you know, to make nutrition and hydration important from an exec level. As a trust, we've also developed some staff pledges, and one of these is around care and about well-being of our staff. So our staff experience team ran a series of roadshows over a period of time, and they specifically asked staff about what they would like to be improved from a wellbeing perspective. And nutrition came quite, there were a few nutrition issues that came up quite regularly as part of those roadshows, particularly around areas such as out of hours provision of meals, particularly healthy meal options, particularly around hydration and space to eat meals. So having these staff pledges also sort of fed into sort of now being a good time to focus on a food and drink strategy. And also, I suppose, the interim NHS People Plan, which contains a national ambition to make the NHS the best place to work. And I think locally we need to start taking action to best support the well-being of our staff. So I think, again, that's sort of fed into this being, the right time to drive improvement from a nutrition and hydration perspective. And if you could move on now, Susanna. So some of our aspirations. So we very much use the Department of Health toolkit to help us to guide what we should put into our food and drink strategy. So we split our food and drink strategy into 4 main areas. So patient nutrition and hydration, healthier eating for staff and visitors, sustainability and reduction of food waste, and we also added an element, a research and quality improvement element. So in terms of our trust and aspirations from a patient nutrition and hydration point of view, really we wanted to provide consistently safe, high quality and nutritious foods for our patients, and to be an organisation which delivers excellence in nutritional care. And I think sort of we alongside of that, we are a trust that has many different sites. So we've got 3 main sites, and at the present time we don't have one system across all of those sites. So we have different catering contractors, and we have different operational, all of our operational aspects around meal times are different across the trust. So I think one of our aspirations from a patient nutrition and hydration perspective is to have one system across the trust to enable standardisation of catering services to deliver the best possible patient experience. We'd also really like to work collaboratively, to improve the process of meal times and develop a shared vision of what a protected mealtime service should look like. If you could move on to the next slide, please, Susanna. From a healthier eating for staff and visitors perspective, so we have our staff pledges to care about our staff and their well-being, and we really, from that perspective, we are really trying to make UCLH a better place to work by supporting staff's overall well-being. I think another one of our aspirations is to influence our staff and visitors by promoting a healthy food environment, and and also to make healthy eating the easy option, because I think at the moment it's not, and that's one of our aspirations to make that happen. If you could move on to the next slide, please, Susanna. So from a sustainability and reduction of food waste perspective, we really want to improve the environment in which the Trust delivers care. We want to embed sustainability in University College London Hospital and empower staff to make changes. We want to ensure robust governance to monitor progress and align with UCLH strategic objectives. We want to demonstrate leadership in this field and also to fulfil the requirements of the NHS standard contract with regards to clause 18. Next slide, please. And then our aspirations from a research and quality improvement perspective. So our aspirations really are to become a world-class academic research hospital, embedding research throughout the organisation and all disciplines. And I think we've added a research and quality improvement element to our strategy, really to help to represent our aspirations as a trust. Next slide, please, Susanna. So I'm going to move on now to what I've done to sort of start to develop a food and drink strategy for the hospital. So the strategy really, that we're planning to develop the strategy to provide staff and regulators with a clear focus of what we would like to achieve over the next 5 years. And what we hope is that the strategy will support the Trust vision to deliver the best outcomes, to work in partnership and to strive to keep improving, and also linked with the staff pledges to care about our staff wellbeing. So what I've been doing up until this point is I sort of started out by meeting with the key stakeholders, many of whom I've sort of put onto the slide that you can now see, really to try and identify what we're doing well, but also what some of the gaps are. So I've been trying to meet with estates and facilities, sustainability, our volunteers, our activity leads, some of our AHPs, so our speech and language therapists, physiotherapists, occupational therapists. I've met with some of the clinicians that have an interest in nutrition and hydration, patient representatives and our governors, procurement, our nurses, midwives, hostesses. So I've really tried to engage with a sort of a wide range of stakeholders, and I've done this. I've met people for coffee, I've attended meetings that are already going on in the trust, and sort of as I've got to know what's going on across the trust, I've learned that there are, I guess, groups of people working towards similar goals that didn't really know that this group was doing a similar thing to what they were doing. So I've also tried to kind of put people into contact with each other so that we can start to work more collaboratively as a trust. Susanna, if you could move on to the next slide, thank you. I found that from the Department of Health toolkit that they developed to help people to produce a food and drink strategy, I found that there were two really key resources that I used, which were really useful visual aids to help people to understand that the strategy can support the requirements of a wide range of healthcare organisations, and also that it helps to deliver increased value for money and high quality services. And I've been taking this particular slide along to when I've been meeting with key stakeholders, because I think it really gives people a very, as I said, visual and clear guide as to why a food and drink strategy is important to have as a trust. If you move on to the next slide, please. And then also using this slide to help people to have an understanding of the types of things that we might be including into our food and drink strategy. So some of the things that we might be focusing on. And I think this has really helped me to focus my discussions with people as I've been meeting with them. And really what I've been hearing to date is that we have, you know, as a trust, we've got some excellent initiatives that are already taking place, such as, for example, I spoke about before, the exemplar ward initiatives that we have, and there's been some quality improvement projects around nurse-led meal services, which has really helped to improve how a meal service works on particular wards. Also things like supporting an enjoyable eating environment by encouraging meals away from the bed. We know that if we can do that, that can help to improve how much people are eating. So I think that's a really great initiative that we've already got happening at University College London Hospital. And also we promote nutrition and hydration throughout the year with engagement events, in events such as Nutrition and Hydration Week. So I think, you know, from speaking to people, it was very clear that we've already got some really great initiatives going on, but that there were also some, you know, a lot of gaps that we identified that could be improved. So what we all, apart from sort of meeting with key stakeholders, what we decided to do in terms of helping with the development of the strategy was to do a World Cafe. So I started to plan the World Cafe event in partnership with the Soil Association. So Susanna McWilliams has been helping me to develop the World Cafe and help me to facilitate the event that we ran. And we really wanted to use the Soil Association due to their sort of wide range of experience in developing such events. So I know that they've helped other trusts with the development of their strategies. And we wanted to be able to also at the event to be able to share examples of good practice from other hospitals. And so this was using the Soil Association was a really good way of us being able to share some of the other good practice that and learn from other trusts. We also wanted to add a national context to the event, which we got by including the Soil Association. So having a World Cafe was really the main opportunity for us to engage with a wide range of stakeholders. It wasn't the only opportunity that we had, and we've still sort of got plans moving forward, but this was going to be really the main opportunity. And so really what we hoped to hear from people were, we wanted to get people's views on key areas. We wanted people to be ambitious. And we wanted to know what people thought the Trust priorities should be over the next 5 years. And what we did was we used the following sort of methods of communication to help to get people to know that the event was taking place. So I sent out emails to key stakeholders and sort of sent out diary events, so held the sort of the event in their diaries, blocked out their diaries, and I did that quite far in advance so that people would know the event was taking place, and it gives people the opportunity to be able to attend. I wrote a blog, I wrote several blogs actually, sort of highlighting that we were holding the event and the reason why we wanted people to come and contribute to creating the strategy. I used our comms team, so we have a staff intranet where you can, and I developed some sort of communication to enable, which went out on the intranet to enable people to understand what the event was and to invite people to attend. I also developed some posters, so they went out in key places across the wards, but I also delivered those to the wards and spoke to ward sisters about the events, because what I was hoping was I was trying to get as many sort of representatives from each ward that we could. So I sort of went up onto wards and engaged people on a face-to-face basis, as well as sort of leaving the posters on each of the wards. And I used Twitter to sort of to communicate the fact that the event was taking place as well. I think the main thing that got people to attend the event was really by word of mouth. I think I've been really fortunate to have the support in the development of this strategy from our Deputy Chief Nurse, our Head of Nutrition and Dietetics, and our Head of Soft Services. So since November, really, we've all been trying to sort of spread the word in meetings. We've been attending to encourage people to attend. And I think everyone we've been meeting, we've been sort of saying, oh, make sure you come to the World Cafe. And I think the fact that we've continued to do that over a period of time meant that, we sort of got the word out there and got people to be engaged with attending the event. Next slide, please. Thank you. I also worked with Interserve, who are one of our catering contractors, to help. So they agreed to provide the food for our event. Some of the pictures there are of us attending a tasting session. We really wanted to support the sustainability theme of the event by having food which was sustainable. So we didn't want to use any plastic or paper plates or any plastic cutlery or anything like that at the event. We wanted food that was in season and locally sourced produce. And we we managed to do this through using Interserve, and as I say, this is some pictures of us at a tasting session where the Interserve really sort of talked us through what they'd done with the food and how it had been produced, and where the food had come from. So all of the meat that was used in the food was from local suppliers, as were the sort of any fruits and vegetables that were used, and all of the vegetables that we used were in season. So it was really great to be part of that and help to develop that food. So it gave another element to the World Cafe, which was quite exciting for people to attend. What we also did as well was, when we were sending the agenda out to people, we asked that they bring their own cups and water bottles, so that we could try and, we also had crockery there as well, but we were trying to encourage people to think about sustainability as part of the event. So we developed, this was sort of, on this slide here is the agenda that we developed for the day. So we started by a welcome and setting the scene, and we invited our chief nurse, our director of workforce, and our head of services to deliver the introduction, to set the scene around the topics that we plan to cover, and really to share their vision to the attendees. So that's how we started the day. And then Dr. Susanna McWilliam presented. So she focused more on the national context from the sort of hospital food panel being published in 2014, which I think sort of really, she explained how that really sort of joined the dots onto what hospitals should be focusing on as organisations. And then she talked right through up until sort of 2019 with the listeria outbreak and the hospital food review being announced by the government. And what she also did was gave some really good examples of other good practice which was happening across the country, to give people some ideas of the types of things that we should be thinking about in the development of our strategy. And then we moved on to the exploration session. So this really was the main part of our event, and we had 4 tables, and we sort of split the attendees, so there were around 12 to 15 on each table, and each table had 2 facilitators who were sort of either experts in each of the areas or people who had a keen interest in the area. Each of the table had a different topic and different colours, as you can see from the slide. So we had sort of green for patient nutrition and hydration, and blue and yellow and orange. And each of the attendees moved around the 4 tables during the workshops. And what we did was we put a brief description of what the table name meant on each table, to give people an idea of the types of things that we would be expecting of them. Before we started the exploration session, we gave each of the tables chance to get to know each other through sort of we did an icebreaker. So we got people to make something out of plasticine, which was health or nutrition related. And I think that was a really good way of getting people to start to talk on their tables. And I'll show you some pictures in a minute of what kind of people produced. During the exploration sessions, we had 4 sessions for these. So the first session we ran for 30 minutes, and what we directed people to the tables that they had the greatest area of expertise in, so that we would ensure that we had a good spread, and that we would get the most out of that first 30-minute session. During that 30-minute session, we were asking people to think about what we're doing well now, what should we be doing, and what are our priorities for change, and who is best to operationalise this. So the participants on each of the tables had 30 minutes to think about those 3 questions. And what they would do is they would write down their ideas on Post-it notes, and we used post-it notes to allow sort of easy movement of information into key themes as the day progressed. But what we would then do is use the facilitator to sort of gather in ideas, group them into themes, and sort of sum up some of the key themes onto large post-it notes. So the first session, participants had 30 minutes on the table, and then the second, third and fourth session, they had 15 minutes on each table. And on those sessions, we focused really on what we should be doing now and what are our priorities for change. So each participant had the opportunity to sort of contribute to each of the topics. We then did a roundup. So this is where the facilitators sort of fed back to the whole group, identifying the content from their tables. And what we did at this point is that the facilitators gave sort of more focus to the points which had come up more than once. So we used stickers to identify if there were common themes, and we sort of gave more priority to the ones that had come up more regularly, as these would probably be our priorities moving forwards. And then we had an opportunity for next steps and questions from attendees. So our Deputy Chief Nurse and our Head of Nutrition and Dietetics facilitated this session, and they really sort of shared their reflections from the day, shared and agreed next steps and how those in the room would be involved. They talked about ownership of actions and methods of communication, and talked a little bit about the sort of launch event and the future governance of the food and drink strategy. I think this slide that's just come up, this is what facilitators had on the tables, and this is where the post-it notes would be put. So we've kept these now. They've got all the post-it notes on them, and we've managed to be able to group sort of key themes from this. So this tool here was a really good, useful tool that the Soil Association produced, that we were able to sort of enable attendees to know what the questions were, but also for us to be able to keep the post-it notes, so that we can then use those to develop then write up the strategy. I think at the event we were really fortunate to have representation from a wide range of professionals to contribute to the strategy. So if you think back to the slide that I showed you on which had the names of different professionals, we had somebody from all of those professional groups attend the event. So I think we had about 60 people attending for the afternoon, which, you know, we ran this event on the 9th of March. So the COVID-19 had just started to sort of take its effects. So the fact that we managed to run the event and so many participants still managed to turn up was really, really brilliant in terms of us being able to develop a strategy that's had a lot of input. So these are just some of the pictures from the event. You can see there's a gentleman standing holding a plate. So that is some of the plasticine models that were made in the icebreaker. That's Ian, our Head of Nutrition and Dietetics. There's a picture that shows, so our chair attended the event, and there's a picture of her. There's a picture of our Ben Moran, who's our workforce director, and there's a picture of Susanna doing her presentation, and there's also a picture of the food. So that's what our sustainable, locally sourced, in-season food looked like, which, as I say, that contributed to lots of discussion on the event and was great. Next slide, please. So I guess what we learned from the event is really important. So as I say, I'll go through each of the sort of topics and share really what we as a trust, sort of the main priorities that came out. So from a patient nutrition and hydration perspective, there was a lot of discussion around sort of protected meals, and it was very clear that you know, people really wanted this shared vision of a mealtime service, and they wanted to work towards improving protected meal times, which really sort of fed into that. You know, that was one of the aspirations of the trusts in the first place. So I think from that, you know, what we've really identified is that we actually at the moment don't have a protected mealtime policy, and I think that, you know, having a protected mealtime policy, but having that worked on by sort of key sort of stakeholders, so you know, nutrition and dietetics and nursing and catering coming together to sort of develop that protected mealtime policy, I think was one of the things that came out of the event. Access to kitchens, so we don't have access to be able to go into our kitchens on all of our sites. And there was a lot of discussion around how this would really help to, if we did have access, how this would be able to allow the nursing staff on the wards, the dietitians, the catering team to be able to have better access to nutrition and hydration for our patients. I think particularly around out of hours provision of food and beverages was kind of you know, where a lot of the focus on having access to kitchens would work, but also that actually by not having access to kitchens, it means that on some wards particularly the ward hostess is not felt of as part of that ward necessarily, whereas if it was more of an open kitchen, then that ward hostess may well be integrated into that ward better, which would help that mealtime service to run in a different way, and it would help that communication between the nurses and the catering and the catering services. We also have beverage bays on all of our wards. Each ward has a beverage bay, but these are not standardised, and each has different facilities on it. So there was a lot of discussion around having these standardised, updating the facilities. So, you know, having access to sort of bigger fridges, access to hot and cold fresh water, and tea and coffee to enable staff and volunteers and visitors to provide additional options for hydration throughout the day for our patients. So those were the three sort of key themes that came out of. There were lots and lots of different ideas that people had, but they were the three sort of priorities, I suppose, that we identified from a patient nutrition and hydration perspective. From a healthier eating for staff and visitors, access to out of hours healthy food options was sort of identified as being one of the priorities, and things such as, you know, having vending machines that you could provide ready meals, restaurants opening later, things like selling off the food at a cheaper rate at the end of the day, and providing standardised facilities in staff rooms kind of came out of that as ideas for helping to develop this more out of hours healthier options for staff. Hydration was identified as a big priority. So this was around sort of having access to more water stations, access to tea and coffee, both for staff and visitors. There was a lot of talk around sort of hospitality. So we talked a lot around, you know, if you are at home and you invite somebody to come round to your house, the first thing you would do is offer them a beverage, so a tea or a coffee or water, and that perhaps we should be doing this as a trust for our visitors. And there was also a lot of discussion around sort of signage. So, you know, having appropriate signage to allow visitors and staff to know where the nearest water station is, where the tea and coffee facilities are, where there is access to be able to get food, so vending machines or staff and visitor restaurants, because it was felt that at the moment that signage possibly wasn't there and leads to a lot of confusion for sort of visitors particularly. And then there was a lot of discussion around changing the culture around meal times around break times for staff. So having, we talk about protected meal times for patients, but thinking about protected meal times for staff perhaps. And there was, discussions around leading by example. So, if our sort of managers are taking breaks and not eating at their desk, then that may encourage other staff members to take breaks, to eat away from their desk, and trying to, as I say, move away from that culture where we do sit and eat at our desk while we continue to work, and actually having a proper break. If you could move on to the next slide, Susanna, thank you. So from a sustainability perspective, there was a lot of discussion around plate waste and thinking about using different portion sizes. So at the moment, all of the portion sizes are standardised, and whether we should have smaller portion sizes for people with smaller appetites so that we're reducing plate waste. And that linked into sort of order process. So looking at how we can use technology to make the order process better in terms of reducing waste, but also giving options in terms of how far in advance you then need to be making orders, and also making the sort of accurate orders being made to the catering departments. And then there was a lot of discussion around sort of staff incentives. So things like, if you've got salad bars in staff restaurants, that, perhaps staff could bring in their own containers, and there could be incentives to do this, so that they would get money off of, perhaps they would get money off of the salad if they brought their own container, like you do with, if you go into any of the big sort of chains now, to get coffee, if you take your own cup, then you get a discount. Well, thinking around the same sort of incentives in our staff restaurants for staff. And then from a research and quality improvement perspective, there was a lot of discussion around how do we learn what others are working on within the organisation, that perhaps there should be some sort of central repository of projects, but how we need to think about how best to share these, how to make them accessible. There was discussion about perhaps all nutrition related projects going through the nutrition and hydration steering group, and so that they can have oversight and sort of connect people and projects. Whether there should be some sort of official screening on entry for projects, if so, who might do that? But there was a real drive to allow there to be more learning events on a larger scale to enable sort of cross-professional discussion and collaboration. And then there was a lot of discussion around MDT collaboration. So thinking around the benefits of MDT collaboration, not only sort of to strengthen projects, but also to reduce the burden of carrying them out. And I think, if I sort of summarise this, I think really for these initiatives to be most successful, it's really important that, as a team at UCLH, we're working in collaboration. The Power of Three campaign sort of encourage caterers, dietitians and nurses to work in close collaboration to create a holistic approach to nutrition and hydration. But I think it really extends wider than these three NHS professionals. And I think from a UCLH point of view, if we can collaborate and we can really work towards bringing some of the gaps that we have as a trust together and improving nutrition and hydration across the trust. So I guess now moving forward, so we've run the World Cafe now. So what we're looking to do now is I'm working with some of the key stakeholders. So our head of nutrition and dietetics, our deputy chief nurse, and our head of soft services. So those three key individuals are all part of the nutrition and hydration steering committee, and we're working together to kind of debrief from the World Cafe to try and identify from that World Cafe what our priorities should be. If it wasn't identified by the World Cafe, then who is best placed to operationalise some of the priorities, and really putting our priorities into a 5-year timeline. So what are the sort of easy wins that we can do in the first year, and what are the things that might take a bit longer. And then, you know, the plan is then to publish the strategy and to sort of do some kind of launch event around the strategy. So hopefully that has given you a bit of an insight into the journey that I've been on since I've been in this post. The strategy hasn't fully been developed yet, but it's been a really interesting journey for me to get to this point. So I'm looking forward to the next steps in terms of publishing the strategy and perhaps doing a launch event. Thank you very much.
Helen, thank you so much for talking us through the very kind of detailed way that you've been developing your food and drink strategy, and having worked with quite a number of trusts in the past. I think the way you've been approaching it is kind of exemplary, and the fact that the trust have initially invested resource and time into your role is incredibly helpful. There'll probably be people listening today who are a little bit jealous of the time that you've been able to give to it, but it's a real testament to how hard you've worked on pulling this together. So I think you spoke to us at the beginning about why this has been the right time for the trust, and that makes perfect sense in many ways, that maybe a year or two ago the trust just wasn't in the right place or time to be looking at the food and drink strategy, but now is the time to be kind of mobilising and moving forward with it. You talked a bit about the aspirations to create continuity of services and standards across sites, really in line with trust values, and particularly for larger trusts that will resonate, I'm sure. Your inclusion of the research and quality improvement work stream, I think, is particularly interesting, and maybe a takeaway for other trusts to think about the research and quality improvement side of things, especially if that's a focus for their own particular trusts. And things like working on comms to drive engagement, and that word of mouth that was important through your senior stakeholders has been something that has meant that you've kept your stakeholders on board as you've gone along. And again, you managed to ensure that 60 people were at your event, which again is by far the largest event that I've come across, bringing different disciplines together. So we're going to open up the floor to some questions. Claire, you were going to pick up any questions that have come through on the instant messaging, and so if I just pass over to you, Claire, for a minute to share any questions that might have come through.
Hi, Susanna. Thank you. Thanks, Helen. That was really interesting. We don't have any on the chat, but quite a few people have dialed in rather than on a computer. So if anyone would like to chime in with any questions, please do so.
Thank you, and thanks, Claire, and don't forget to just unmute yourself. So I'm going to go quiet for a minute or two to give you an opportunity to unmute, introduce yourself and ask a question. If not, I've got a couple of questions up my sleeve for Helen.
Hi, it's Karen Newman from South Warwickshire Foundation Trust.
Oh, Karen, welcome. Lovely to have you on the line.
Hi. I'd like to ask, she's talking about a nurse-led mealtime service, and I just wanted to know what they were doing regarding that.
Okay, Helen, should we pass over to you? That was Karen from South Warwickshire asking about the nurse-led meal service, and if you've got an opportunity to just flesh out what's involved in that.
Yeah, sure. So that was as a one of our exemplar award sort of quality improvement projects that they run across a number of the wards, and I think each ward has done it slightly differently, because obviously each ward's mealtime service looks slightly different, but I think what they've mainly done is sort of got nurses back into kind of taking sort of accountability of the mealtime service. So I think what was identified by the wards that have done this as a project is that there was a bit of a sort of lack of engagement between the ward hostesses and the nurses. and perhaps a lack of engagement from I think the mealtime service was just happening around sort of clinical activity, and that perhaps the nurses were not as involved as they perhaps could be on the ward. So what they've done is they sort of now have a lead for the mealtime service on some of the wards. So whether that's a nurse or a healthcare assistant, there's sort of an identified lead for the mealtime service. They have tried to sort of stop any sort of urgent non-clinical work. So they're trying to work towards that more sort of protected mealtime service, and that they're very much working towards enabling the patient to be ready for the meal. So making sure that the sort of trays that people have in front, or their tables, are clear, so that there are so that the food is the only thing, or as much as possible the only thing that's on the table while they're eating. The identification of patients who need assistance with eating. So I think they've just become a lot more. There's also the ward hostesses are now part of the handover, so they have produced kind of communication boards that identify patients that need a bit of extra assistance with eating, or anybody that's on a special diet, for example. So what else have they done? They've also really used volunteers to help with the meal service. So the volunteers now are we have a soup round on each of the wards, so the volunteers are now doing the soup rounds, and they will also go round to anybody who is needing any additional sort of condiments or things like that. So just making sure. I think really what has happened, they're not doing anything that probably I don't think they're doing any sort of anything new. I think what they're doing now is they're working more as a team, and I think that has really helped to. I think that we moved away from that for a period of time on some of the wards in the hospital that I work, and I think what they've realised is that actually by having somebody who's in charge of the service, by having better communication, that actually it means that the mealtime service works much more effectively, and patients now are more likely to get what they want, or get what they've ordered, get that assistance that they need with eating, and it just improves the general sort of eating environment, I think. So I hope that's answered your question, but I don't think they've done anything kind of that perhaps shouldn't have already been happening. But I think the refocus on it has meant that it's really improved the mealtime service on the wards.
Helen, thank you so much for that. Karen, I hope that's been helpful.
No, that's really helpful. Thank you.
Thanks, Karen. So I think we're going to move on to Phil now. I'm hoping, Phil, that you're still on the line with us. I am aware that there may be some people who've been trying to ask questions through instant messaging. I'm afraid we're having some technical issues at our end. So actually, before we move on to Phil, can I just ask, Stephen, were you trying to ask a question on the instant messaging? And if you are, would you mind unmuting yourself and just asking it over the microphone? So again, I'll go quiet for a minute to give you a chance to ask your question.
Yes, I did start to type something in, but somebody interrupted me when I was at the desk. Anyway, I was interested in the access to the kitchens from the staff point of view, and I understand where you're coming from in including that, and having the inclusion of staff being able to use these facilities. But wouldn't there be problems then with keeping the kitchen areas clean, and also more importantly how it will affect the budgets?
Thanks for that question, Stephen. So Helen, are you happy to pass over to you on the question around access to kitchens and some of those challenges that Stephen has recognised?
Yeah, I mean, I don't think what anybody's proposing is that it should be a kind of free for all in terms of, you know, being able to everybody have access whenever they want to. But I think, you know, what we've identified, because we have different sites on as part of our trust, and some sites there is access to be able to get into the kitchens out of hours, so that you can use and we're not talking about people being able to heat food up or anything like that, because I know that there's issues around kind of food and safety training, you know, food and hygiene sort of training, but you know, things that, so at the moment when we as a trust, if we want to order a snack box, that has to be done through our portering service. So actually, if somebody misses an evening meal and then you know, we have to order a snack box, it can take hours for that snack box to be delivered, which is not a great service for our you know, for our patients. Patients shouldn't need to be out of hours waiting for hours to get a meal. So actually, by having access to, you know, even if that is just the person who's in charge of the ward at that particular, you know, the ward sister or the charge nurse has a key to be able to get into the kitchen, so that some of the snack boxes can be left in the kitchen to be able to give those to patients, you know, if out of hours a meal is needed. Then I think that's the type of thing that we're talking about in terms of access to kitchens. I don't think we're hoping that, you know, that we're allowing everybody to have access whenever they want to. I think it's in a controlled way, but in a way that enables our patients to be able to get the best possible nutrition, particularly out of hours.
Lovely. Thanks very much for that, Helen, and thanks for your question, Stephen. So, okay. Phil, we're hoping you're...
Can I just say, Helen, I thought that was a fantastic case study, and it's inspirational, you know, what you've done. And I had the same thoughts as Stephen, and I know Tim's on the line as well, and very much has kind of tried to open up things like, you know, having that access to kitchen so people can kind of think and work a little bit differently. But we are kind of, sometimes we're a little bit stuck, aren't we, with what we've done in the past, and we protected kitchens, you know, because of food safety and obviously other issues around hygiene. But I think some of the nudging and inspiring towards staff health and well-being is excellent. So thank you for what you shared today. I thought it was excellent.
Thanks for that, Phil. And I'm going to introduce you again, because I think you dropped out of the call when we first introduced you. So I wanted to say really huge thanks, Phil, for joining us today. And as I mentioned earlier, as well as your day job as facilities manager at Taunton and Somerset NHS Foundation Trust, you've been in the past the chair of the HCA, and currently you're the chair of the NHS Food Review, Phil. So very busy man, and thank you so much for talking to us today. So I'm just going to pass over to you now.
Yeah, of course. No, thank you for that, Susanna. And, you know, thanks everybody for being on the line and giving up time. I know an incredibly busy time, and obviously, as ever, we're so reliant on people like Taylor, who's looking after us on a technology point of view. So thank you for linking us in. Our IT system decided to go down at 11:10 today, which was really extremely helpful. But anyway, we're back online. And obviously at this time we're not where we want to be today. We all wanted to be in the same room, you know, kind of sharing experiences with each other. But I think it's great that even though the pressures are out there with the coronavirus, you know, those people working in that environment, as well as others that are supporting efforts around the country, I think it's great that we can give up a bit of time now to help sort of, you know, push back some of the barriers that are out there and sharing great practices with each other. And of course, you know, today is very much about me trying to share a few thoughts around the root and branch review, which was announced by the Secretary of State at the end of August last year, you know, following the 7 deaths of listeria, which obviously is tragic in its own standing. And I know, you know, for some people outside of our remit, there maybe is no comparison to where we are right now, but I think it's important that we don't lose a focus of what happened last year, and what changes that we can make going forward. And I firmly believe that what the report will do is bring radical change. I think there needs to be transformation in where we are. I mean, Helen mentioned the report from 2014. It was updated in 2017, and worked very closely with Diane Jeffrey to ensure that the work that happened in 2014 is very much, you know, recaptured and used again. We must not forget about things that have happened and the positive changes that have been made, but what we must try and do is again inspire people to go to the next length. The election in December kind of obviously means that we're in a slightly different position to where we wanted to be, even without the coronavirus. But you know, it is important to share progress. I must say it's important to mention a number of individuals that joined the panel. When we first announced the panel, we were automatically going to face a bit of criticism. The reason for that is that we probably could have had over 200 people on that panel. There are a number of people that contacted me and told me that they should be on it, and a number of people that, you know, we could have quite easily have asked. But it was about trying to have a tight-knit group that we felt were able to link with other associations and organisations as we try and progress a positive message, as well as try to progress visits not only to hospitals but to suppliers and other meetings and associations that are going on, to ensure that we listened. And often we feel that, you know, nobody is listening to us, and what we didn't want was a review that didn't open the doors to everybody who felt they had a voice. It's important also to stay on track and have a report that has substance, you know. So, and what I mean by that is have an awareness and a balance of what other people think, but also of what other panelists think. So there are also going to be people on that panel that maybe are on that panel for a specific reason, and it was important that we listened to them, but also important that everybody had their view. And obviously, you know, Susanna was on the panel, and I've got to say personally, she was a fantastic ally and has certainly represented the Food Life programme to the full. And she knows personally that I'm very thankful for that, but I think it's important to say. Just kind of as an overview, I think that we know within the NHS we have a number of challenges. Continuity is a big thing, and how can we take services forward in the future, and about our level of performance. You know, we all look insular often at what we're doing compared to everybody else, and our focus is very much within. But as Helen shared, you know, she's trying as UCL is to try and push back their standards to where they want to be, and I hope that the report will push that level of performance for everybody to a level which one is more than acceptable, and going towards that exemplar. And you know, I feel very much that leadership is a key task for us within our own sections of the NHS, but also the way we look to leadership in our own NHS, right at the very top. And if we want to push back the barriers, we need that leadership within and also from outside to help us give the direction that the food review, you know, will encompass. So okay, we all have an accountability in our roles, and I know that, you know, whether you are a leader, whether you're a chef, a catering assistant, a manager of a different type of service, and whether you're a supplier, dietitian or nurse, you know, I think we've all got a sense of pride in what we want to do, and it's that linking together that makes that possible. So we've got a couple of slides here. You've got one in front of you at the moment, which shows that food is very much an emotive topic, and of course the media, you know, often it seems to enjoy, you know, stamping on the good work that's done, and I think that we often feel that food is a service that gets knocked, and healthcare particularly can often be at the forefront of media campaigns. I just want to pick up a couple of messages. So before we took the review forward, I wrote to a number of people, and did likewise with Helen, did a blog, and also put out some messages through the media. You know, and some of the messages that came back were very disconcerting, but also realistic in the pressures that we feel today. So I've got 3 or 4 patients that wrote to me, and if I could share that with you now. The first one said, well, I've had 4 long stints in the acute general hospital over the last 3 years. They never had any suitable breakfast for me, and lunches have been inedible. The one time I risked having a dinner, I was badly cross-contaminated. Another one said, well, every time I have relied on family bringing me in sandwiches from Marks and Spencer's or from home, so I can at least have something to eat in the day. There are days when no one could visit, and when they did, I was unable to get the food I wanted. Another patient said, the operation I had recently was supported effectively by the team. I was treated with dignity concerning my allergies, and even the chef told me to suggest some things that I fancied to eat, and he whipped me up food that was safe and tasty. And the final one was, on numerous occasions when my wife has had to stay in hospital for procedures, she pre-warns the hospital of a celiac disease. However, there is never anything to eat. She's even been told by the catering staff, surely you can have the dinner if we take off the pastry on the pie. So this tells us, and if we look at the next slide, it tells us that, you know, the NHS is one of the biggest brands in the world, yet we seem unable to maximise the positive aspects, and we struggle as well to celebrate our achievements. So realising that perception in the public can be damning, but I think what we must do is picking up that whole power 3 approach, is that throughout the system, you know, we can strengthen our resolve and our resilience if we pull together. And the next slide picks up on leadership, and experience tells us that partnerships that you develop over a number of years, you know, it can provide loyalty, trust, and a chance to share knowledge. You know, often when you talk about things like, you talk about the Soil Association, you talk about suppliers, you talk about hospitals and other associations, you often think of a name and you think of a person that you can link with. And that enables you to build robust partnerships and hopefully using each other's skills to benefit the recovery. The truth is we're stronger together. And it's important that we open our own doors to say, you know, sometimes we don't get things right, but what we do want to do is learn from each other and learn from those experiences that have either been extremely challenging, or they've been positive experiences that we've been able to go to a new level. We've got to remember that our leadership brings into focus our direction and our belief. Quality and of course technology is very much at the tip of our tongue at the moment. Communication and the way we collaborate. Today's pressure in healthcare identifies the importance of successful teamwork. we're encouraging staff to stand up as leaders of the future. And that's not easy right now, where they can often think, well, why should I put my head above the parapet when I know that it's gonna, it's gonna be a challenge that, I don't really want to take on. But I think we're looking for people that don't mind having a formidable appetite for work, as well as a desire to drive standards. We want them to be able to stand up in the knowledge they have our support, and they're not frightened as well to make mistakes, and we will support them through that and learn together. Any commitment we have from our staff right now, it needs to be aligned with the values of the organisation, because we've got to have that conviction that we will reach the right conclusion. And sometimes it may be going through a little bit of pain first, but we will get there. I remember when our trust made that decision to go to same-day meal ordering for patients, it was about having clarity. Sometimes ward teams, again, can often work looking in at their own environment and their patient acuity, but they had to understand that the approach that we were taking would give them the confidence in the knowledge that change that would happen would not be at the expense of minimizing the food choice for patients. The next slide, it picks up on quality assurance. And whatever changes that we make, we've got to remember that positive results through the current challenges will require you to balance your decision making with your aims and objectives and the procedures around us. So we've got all of these things as a governance within the NHS that helps us make decisions with core processes. What we've seen in our visits around the country is often great services in hospitals because the chief exec, the chief nurse and the finance director totally understand and support the principle that food is medicine. And I think if you're one of those trusts, you're in a fantastic position. Please don't sit tight and think you're comfortable. Keep pushing back those barriers and those areas where you feel that you can, be even much more of an exemplar site. And think of those other trusts that haven't got that type of support. And on the site visits, we went to many trusts that don't have that support, and they need us, as a panel and as a wider remit around England to help these people move to another level. We need an appropriate skill base. We need a strong accreditation, and we need service level agreements that provides confidence through the system of service delivery. So as we do our service delivery, we have a confidence of what we're taking it to, the quality of the product, and how that meal is being served. The next slide tells us about how we can make progress. We know that as well as food being a form of medicine, it's also an occasion. We saw some great areas where pop-up tables were being produced in really crammed spaces. Some areas had, day rooms, and some had none. So these pop-up tables helped people to have a sense of belonging. Meal times have an enormous sense of value. It's vital that what we provide in our services is recognised as exemplary. And often we get some things right, but some things are more difficult. It was discussed earlier around 24/7 catering. I know a number of us on the call today have tried to do different things, which kind of it might just about meet the objectives, but we deep down we're thinking, we need more. We need a better choice. We need more availability, and we need areas where people can take those meals out and actually sit down and eat. We often say that, whether it's 2 o'clock in the afternoon or 2 o'clock at night, our staff should be able to have food of quality and areas to be able to rest and eat. You know, what we can share with you is we know that collaboration of nurse and dietitians and creating, of course, creates a strong force. You know, when we work well together, we're a powerful unit. We can share in success, and we're aware that food must also be clinically appropriate so that everyone who needs more help with their food to eat and drink gets it. I believe that facilities teams are evolving. We're often involved in a lot more in just catering, but we've got to believe now that we are a front of house. You know, we need to be closer to the needs of what people require, closer to the needs of the people that we serve. The next slide picks up on nutrition, hydration, and again, it's understanding that a lot of the focus can be around nutrition. But as Helen said earlier, we need to think that there are areas where people can get the hydration that they require. You know, have we got water and other drinks available around the clock to ensure that people have what they need? Our patients and our staff and our visitors need us to drive commendable attitudes and efforts every day of the year. This week is Nutrition Hydration Week. And we celebrate so much, but what we must do is have the same facilities available around the clock every week of the year. We've got to balance our approach in innovation by using our capabilities intelligently. We've got a lot of people in our services that have got great experiences, and often we don't use it. And when we use it and we do it well, then we need to shout about it and share the success. The case study today, you know, told us of loads of different things that are happening. And I'm sure, like you, I was penciling down lots of things that they've done and they've learnt about and they're trying. And you know, if it works, then we should be sharing that impact around England. The next slide tells us about how we can influence. And you know, obviously the review tells us several things. I've noted a few things up here which I hope will just give you a taster of where we're going. Of course, there's been plenty of progress around menu suitability. We know that patient screening is happening. We want it to happen at 100%, you know, and not just under. We know that that can often be time consuming, but if we don't know what patients need and what they can't have, what we need to do to rebuild them up so they recover as quickly as possible, then it's difficult for us to have a formidable structure. We know that often a combination of food services provides stability of choice. So you may be cook freeze, you may be fresh cook, you may be cook chill, but a lot of hospitals now are developing a range of services within their hospitals to ensure that they meet, you know, different types of patient acuity. Our planning needs to be sustainable. So whatever we do now, we need to be sure that we can either flex that or we can think that whatever we plan is a sustainable method. We've got to remember that if we work by short-term measures with no innovation, then it is likely that we will produce poor results in the long term. What we must do as catering leaders in NHS is build on the foundation. The HCA, the BDA, Food for Life has helped provide a very, very solid base for us to work from. But we've also got to create a suitable link in the political landscape. We need the support from government to make the changes that all of us desire. You know, we require the opportunity to influence and make the impact that will support a significant step change. The opportunity of a root and branch review are few and far between. We've got to challenge our industry, we've got to challenge our colleagues, our government, but most of all, we've got to challenge ourselves if we are to achieve safe, nutritious, quality food and drink that is sustainable and cost effective. If we look at the next slide, there are several people that wrote to me about their views about what the review should bring. Please can we ensure that it is recognised that a healthy diet can mean very different things for our patient groups in order to meet their diverse needs. Another one said, how do we balance the review to be sufficiently diverse, to cover all aspects that need consideration, but simple enough to be manageable and usable? And that's really key, isn't it, with our services, that it is no good trying to produce something that is unmanageable, not practical, and our staff have not got the skills to produce. Another colleague wrote to me and said, well, the past few years have seen massive change in our menu choices. The purposeful use of butter and cream has added flavour and fortification as a treatment of nutritionally vulnerable patients. Another one said, catering staff are a vital ingredient for any kitchen. To enhance recruitment, we must campaign for better salaries, which currently bear no relation to the important job that NHS chefs lead on. And we know that that is an important aspect, and the panel, has picked up very quickly that certainly chefs need to be on at least a band 3, and that there needs to be a solution for chefs to meet each other regularly, to share, again, their challenges and also their case studies on how they've improved their areas. And also menus need to be regional. This can be supported by patient surveys. In this way, you get a clear picture of what patients, staff and visitors require. I do believe that the NHS needs to go through a radical change to build a more harmonious working environment. Some often say that knowledge is power, but I say that share the knowledge and you share the power. So you've seen a few things on the last couple of slides that show that the areas of focus are not going to be a surprise, and I believe that they will make a significant difference. But what we must do is endorse the recommendations as trusts, as hospitals and as teams. One size does not fit all, so the experience between our caterers and suppliers must provide us with a provision in each establishment that creates food that is at its best at the point of service. As we go to the final slide, before I close, I'm happy to talk through, maybe through the questions, a couple of the recommendations and how we feel that we can make that difference. But I think, just to close this off now and open up the floor, I think that adapting our service for the modern day NHS is extremely challenging. It is an amazing opportunity. We must bring a pride to the way that we work. So we've got to help staff realise that they personally can make an enormous difference to the stay and the recovery of our patients. We've got a tremendous group of people working in the NHS and within FM, not just catering, but also across the dietetic and nursing circle. Nutrition hydration is very much at the forefront of a lot of these teams. But often we feel not, and it can be quite damning and quite damaging. But I think, we've got to stand up, we've got to be counted, and we need to bring a pride to the way that we work. I hope that helps, and certainly willing to talk through a couple of the recommendations if it's a topic that people want to talk about.
Oh, fantastic, Phil. Thanks so much for your insights and for sharing that with us. And as you said, you see it particularly as a real time of opportunity, which is very heartening. I think you started, Phil, by reminding us, of course, of the big picture and the listeria outbreak and why this root and branch review is so important at this time. You also reminded us of the passion and commitments of NHS staff, but I think those letters that you shared at the beginning were a sober reminder of the fact that in some cases the NHS needs to do better when it comes to food, and you call for the need for transformation and continuity across sectors, the importance of leadership and quality assurance. And I think that honesty in saying, Phil, that it's not a straight road necessarily. It's okay to learn from your mistakes, and the idea that sharing knowledge is sharing power. So very inspirational, I think, for anyone who's listening today, and also very honest oversight. So we'd really like to open to questions now for anyone that's on the line. Again, Claire, if you're able to let me know if anyone has messaged in any questions, otherwise we'll go straight to the phone lines.
Hi, Tim Ratcliffe here.
Hi Tim, nice to have you on the call.
Thank you. Just a question for Phil, or a clarification of point really, is obviously we as caterers do, and with our assistance with the dietitians and speech and language, we do as much as we can. Have we got any recommendations there that there'll be the trust will we need to prioritise nutrition and actually believe that nutrition is everyone's responsibility, right from the top, right down to the catering assistants?
Tim, always good to talk to you. I mean, you know, you're an inspiration to me personally anyway. I think you're doing some fantastic work up there in Blackburn, and I said to you recently, you know, never get disheartened, because you really are trying extremely hard to make a difference, and you know, you keep going. What can I say? Well, yes, I mean, what we had to do is have a group of recommendations that were kind of short and punchy, and to do that we've managed to bring it down to 8, but because the thoughts very much mirrored what you said, is that, you know, this is a complicated issue around, you know, whatever we produce, you know, once it leaves the kitchen, it can often leave our domain and not be within our control. So it is important that the whole trust, or each hospital or boards, actually, you know, buy into this success. So we produced a checklist for the catering manager and the chief exec. So we expect nutrition, hydration to be at board level. Now, people will often say, well, it's already at board level, and that's fantastic. If it's already there, let's try and heighten the conversation. Let's try and make sure that it is on the agenda. If hospitals are not being represented, then we need that to happen. So this review and recommendation will ask for that to happen. And what we want chief execs to be able to do, if they, you know, they might decide they want to take this on personally. They might decide, I'm going to give this to the head of dietetics or the chief nurse, but somebody at the highest level needs to be able to look through this checklist and say, this is what we're doing, and they can tick through and think, I'm confident that these are the areas that we're managing to meet. I know that people are working together. But then it asks the questions, so if they're not doing it, then they have the opportunity to either do something about it themselves or ask for that advice, and we will support it. I would expect, you know, and I shared with Susanna earlier, we can never say it will definitely happen, but we're hoping that the report will get launched very shortly. But obviously, you know, the challenges at the moment are something that is well out of our control. But I hope then that the recommendation, the final one, will be around going forward, and that is setting up an expert group that actually can also support and advise. We've got many hospitals and trusts that don't get the support they need within, so therefore, at least, you know, around them, they can go to a group that will come to them and help them make decisions. and if nothing else, represent the Department of Health and NHSI to actually say, these are the recommendations. This is what we need you to do. If you're not doing it, what are the reasons why? And is this something we can help with? We're all in it together. We all want the same result, but often some of us have got more challenges than others to do that.
Thanks, Phil. That's great. Thank you very much.
Okay.
Yep. Thanks, Phil. Do we have any other questions? Okay, Phil, I think that's our questions for now. So I know that you're aware that Emma has unable to join us today for obvious reasons. She was hoping to join us, but has had to be called away at the last minute. So Emma did share that you would be you wouldn't mind giving us an update on the healthcare food standards. So is that okay if we pass over to you for? I know it'll be a very brief update.
Yeah.
Phil.
Yeah, of course. Yeah, and
Thanks so much.
It is. That's no problem. I've sort of joined Emma on the leadership of the standards to ensure that the review links into the standards. I mean, both you and I know from our panel debate that often things can run, separately, but it is so important that the direction that we give for the review gets picked up by the standards group. That there's a massive amount of work that has already taken place, not just from standards in the past, but also recent conversations over the last 18 months. There's no doubt there will be a delay to the standards coming out. One, because they need to absorb the review recommendations, but obviously the processes around how we promote and bring that report together for the standards will now be under pressure, because NHS England and improvement will be focusing on the current pressures. But I'm quite confident that when we get a little bit of space and there's a little bit of light at the end of this tunnel, I think that the standards will be strong, they'll be robust, and again, very much like the review, it is not something that can be dropped on people's plates to say, right, get on with it. It needs to be, these are the standards. We hope that you are in a position to be able to achieve, at least a sense of normality. But if you are under pressure, if you haven't got that ability either in your team or around your team, then how can we support you to get you to the point that we are proud of what not just our patients, but our staff and our visitors are provided with around the clock? We need to ensure that food, is a quality product, but the way we produce it needs to be in the right way. And I firmly believe there are lots of different ways of producing great food. And our suppliers and our teams around us help us to do that. So I think we need to just be patient with what's being provided at the moment. There are a couple of chapters that are a little bit behind the timeline at the moment, but I think that by saying that we'll give teams at least through to the end of the summer to produce a suitable standards update, then we'll be able to, over that next 6 weeks period after that, be able to push that through government, because it will need to go through government, and then if everything's agreed, then hopefully at the end of the year or beginning of next year we will have a food standards update that will incorporate the food review, and also provide a stability that all of us are waiting for.
Phil, thanks very much. So there's a lot of reassurance there that these two separate pieces of work are very much interlinked, and that the NHS food review in essence will find part of the recommendations will find their home within the healthcare food standards in a timely manner, with support that goes alongside that. So, okay, that's fine. I think we'll draw it to a close there. So again, if I can thank everyone who's joined us today. And Phil and Helen, a huge thank you to both of you for very enriching presentations today. I've really enjoyed the morning and early afternoon, and to anyone that's asked a question today. Taylor, a huge thanks to you for coordinating the seminar, and to Claire also, who's joined today. So our next steps is we'll be sharing the slides with you and also the recording for anyone who wasn't able to join us. We've got all of our emails on the bottom of this slide, so feel free to drop us a line with anything that you want to follow up with from today. Big thanks again to everyone, and good luck with everything that's facing you in your trusts in the next few months ahead, and we'll be in touch soon. Okay, thanks very much all.
Thank you.
Thanks, bye.